Kimpen is the Philips Chief Medical Officer, a position he held since January 2016. As the leader of the global clinical team, Jan works with 40 clinicians and medical PhDs with the responsibility for advocacy, customer partnership, clinical research, and medical consulting, and is responsible for the annual publication of Philips Future Health Index. The team collaborates with Philips business, markets, and enabling functions to advance clinical capabilities and customers' growth opportunities. He's a strategy advisor for commercial and clinical strategy, market reimbursements, R&D roadmap, and partnership and merge and acquisition. Jan, the floor is yours.
Merci beaucoup et bonjour à tous. Merci beaucoup pour m'inviter aujourd'hui. J'espère que vous me voulez pardonner pour pas parler en français. Après de 30 années à l'étranger, mon français a détérioré terriblement. Donc, je vais continuer en anglais si c'est OK pour vous. So let's continue in English. This was the best I could do on the French part as an introduction. And we are very happy that we can talk today about the transformation that is happening in healthcare and to show you how a big healthcare company as Philips is surfing that wave of transformation and also shaping that way of transformation where possible. Now, we have seen over the years that the transformation in healthcare is really profound. And these are four trends that we see all over the world happening in the healthcare ecosystem. First of all, we realize that in almost all the countries in the world, or maybe even all the countries in the world, there is a resource constraint. The costs of healthcare are going up very fast, are impacting a lot of other costs in every society in the world. So we have to control this one way or the other. At the same time, we see a demographic trend that all of us get older. There is an aging population which comes with the rise of chronic illnesses. Thirdly, we see much more engagement of individual consumers, individual people to engage in their health and healthcare. They want to take the driver's seat, to stay healthy and to take care of themselves as much as possible also when they get sick. And finally, we see this big wave of digitalization that we have seen in retail, in banking, in the travel business already a long time ago. We see this also coming full force into the healthcare ecosystem. And as the previous speaker, Mr. Gordy, has already alluded to, COVID has really speeded up this transformation in healthcare. We see a dramatic move into digital tools and digital means to connect with your care providers to connect between themselves, and patients staying more at home using digital tools to take care of their chronic diseases. Telehealth has accelerated dramatically, where there was a sort of forecast last year that telehealth would increase yearly in the low teens. We see now that it will be adopted to in the 40 to 50% increase year on year in almost all the countries in the world where telehealth is available. So there is a huge surge in adoption. Third, innovation has speeded up. If I can reflect only on some of the innovations that we did in Philips, usually it takes us 1 year, 2 years to bring a new ventilator to the market, to develop a new machine. That took us now only a few weeks to months, including clearance by the regulatory agencies. So the innovation is much more rapid because we, as other companies also do, we try to cater as fast as possible to the new needs of our customers that COVID has incentivized. We have also seen over the last year, during this COVID pandemic, that governments have stepped up their activities. They have become very active in in procurement of ventilator equipment, of personal protective equipment, of vaccines, of drugs that could possibly influence the course of COVID disease. So governments have stepped forward to help their local hospitals and care providers to deliver everything they need for this massive surge of very, very sick patients. And finally, COVID has also shown us that we have to move in other business models and that we have to think much more in an ecosystem and a platform model than on a traditional single hospital with a single patient model. So how is a company as Philips, how are we behaving, or how are we playing our role in that ecosystem that has changed dramatically during COVID, but we played already this game before COVID too. It was a very, how would I say, a very big reinforcement of our strategy that when COVID hit almost all the countries in the world, that we were prepared to serve our customers during these difficult times. And we have basically adopted 5 big strategies to do that. First of all is looking at a patient and at the healthcare delivery in a continuum, what we call the healthcare continuum. We want to help our customers, but also individuals and patients to live a healthy life, to take the necessary preventive precautions and measures if they are belonging to a risk group. If they have to go to a hospital, we want to enable hospitals, doctors, nurses to make a diagnosis fast and confidently. Then we will help them, especially, for example, in the cath lab, to treat patients non-invasively and do this in a very controlled way with as less complications and as big patient and healthcare professional comfort as possible. And we bring products and solutions to the market that can help hospitals remotely monitor and treat their patients. We leverage all the connected care and health informatics to do that. And our common guidelines to see that we are on the right track together with our customers is to build our products and solutions on what we call the quadruple aim. All healthcare professionals probably know the triple aim: better health outcomes, improved patient experience, and lower costs of care. And as we all know, over the last years, there was a fourth goal coming our way that we want to address also, and that is the improved staff experience. We have seen almost an epidemic of burnout symptoms and really burnout absenteeism in hospital staff over the last 3 to 4 years. So we try to connect quadruple aim KPIs and quadruple aim metrics to all the products and all the solutions that we bring to our customers. So this is the first part of our strategy. The second part is already in our strategy for a long time, and that is to embrace the whole digital world. 60% of almost 60% of our innovation and research resources go into healthcare informatics. We use healthcare informatics for different things: artificial intelligence, Internet of Things, cloud computing. We bring into products that help doctors do a better job. For example, we provide them tools to have context-aware patient monitoring. Advanced visualization. We were one of the first to bring computational pathology to the market and help radiologists to quantify lesions and compare these lesions with previous images in the radiology department. And that are just a few examples. So embracing digitalization wholeheartedly is one of our big strategic choices that we made over the last 10 to 20 years almost. The third is that we deeply believe that we have to work in a platform. as was already evident in the discussion after the previous speaker, there is so many new products that come to the market by big companies as well as startups that it is very hard to connect all these point solutions with each other. So we have taken the stance to work on a platform. We see a layer, which you see down at the lower bottom of this slide here, which we call the systems of record. That can be surveys, that can be medication lists, that can be the electronic medical records. It can also be the wearables that patients have at home. We pull all the data, or we can pull all the data from these different sources up into the foundation layer, where we can host these data, take care of all the authorization that is necessary, cure the data, connect the data with each other, store them, if that is the need of a customer, and turn them into actionable insights that can improve the workflow in, for example, the radiology department or the intensive care unit, into intelligence, making use of artificial intelligence, and to improve the user experience. And this platform can be used in all the different propositions that we have in personal health, in connected care, in the imaging department and the CAD lab, and all the other, the emergency room, for example, the intensive care unit, all the different departments or sites in a hospital. Now, the fourth strategic thought that we have is that we realize really well that none of the players in the healthcare ecosystem can do it alone. Not one hospital can do it alone, not one university hospital, also not one company. So increasingly in the future, we will have to learn to work in an ecosystem where all the players that are relevant for an individual consumer, an individual patient, come together and link all their solutions together. And sometimes a company can be the primary player in such an ecosystem. Sometimes a hospital could be the primary player in this ecosystem. And sometimes we are just participating as one member of that ecosystem. And bringing all the data that are very important to build this ecosystem and bring them to the place of care, so to speak, we have, of course, the cloud computing available for that, and for Philips that is called the Health Suite. And finally, the fifth way of catering for the needs of our customers, we do already for a very long time, is to co-create together with the customer. We are meeting customers on a daily basis, and increasingly, yesterday I talked with one of our biggest customers, and he told me very frankly, he said, listen, we are not interested anymore so much in a machine that I want to buy from you. I am looking for a partnership. I am looking to do something together with you over a long time so that we can do the innovation and the innovation of care delivery together. So we have designed a system to bring us together with our customers in a co-creation environment where we first try to listen. And that is very hard. It's very hard to listen for everybody. It's also very hard to listen for us as Philips employees. But we try to do that and understand really well what that customer wants. Then we have a very nice system to try to very sharply articulate these unmet needs and see what they really want, turn it into a sharply articulated vision that is of value to that customer. Then we transform that newly much sharper vision into insights, and we build a solution together with that partner, often over a long period of time, 10, 15 years. So these 5 strategic decisions, so to speak, are underpinning our relation with our customer. Looking at the health continuum, embracing wholeheartedly the digitalization, think in platforms, work in an ecosystem, and co-create the solutions together with our partners. Now, let me now get down to 3 use cases to make it more tangible for you what that could mean. And the first use case is our collaboration that we have with lindacare. Lindacare is a Brussels-based company that we partnered with over the last year. And lindacare has a dashboard for cardiac implantable electronic devices, for example, pacemakers. They can pull the data of all these pacemakers into their software system, irrespective of the vendor of the individual pacemaker device, and turn it into a uniform, into a dashboard with a uniform user interface, whatever the vendor of the pacemaker or the other cardiac implantable device is, so that whatever pacemaker that patient is carrying, the doctor has a doctor-friendly interface that is the same whatever the pacemaker is. We have integrated this dashboard into our IntelliSpace cardiology, so that we have a completely integrated monitoring of cardiac implantable electronic devices in our IntelliSpace cardiology solution, which makes it very, very easy for doctors who are monitoring patients with pacemakers remotely to have it into the software tool that they are already using for other needs that they have. This shows us not only that we can integrate external third-party software dashboards into our own informatics system, but that we are also ready to work in an ecosystem. So the software as a service that lindacare brings to the market has become an integrated part of our IntelliSpace portal solution. The next use case I would like to talk about for 1 minute is deerhealth. Deerhealth is a very nice startup. I would even say it's not really a startup anymore. It has grown out of that role already. And we have gone into a partnership with deerhealth also. And what deerhealth does, they use all kinds of data that, that can be collected along a care pathway. These data can come from surveys. They can come from clinical health records. They can come from wearables that these patients are wearing on a daily basis. deerhealth turns all these data with the help of artificial intelligence into actionable insights for the doctor. For example, a doctor who is caring for a patient with reuma, with a rheumatic disease, or with congestive heart failure, they have all the data along the care pathway of that patient. They give these data in an actionable way back to the doctor, and they suggest the doctor how he could adjust a certain building block in the care path of that patient so that the outcome of that patient would probably be better. And let me illustrate that with, for example, drug dosing adaptations. So through artificial intelligence and through the data that deerhealth analyzes of this individual patient, it can suggest to the doctor that if this doctor changes a certain drug of that patient to a higher or lower dose, the outcome would probably be better. So the doctor can take that advice and change the dosing of a drug, and then the outcome of the patient can be tracked long term. Not only the clinical outcome of the patient is measured real time, and the deviations up and down are measured real time, depending on the decisions that the doctor took on the guidance of deerhealth, but also the economic impact of these changes can be seen. So there is also a module in the offering that looks at the costs and how the costs are varying when the doctor changes, for example, that medication up or down in relation to the outcome of the patient. And then the last use case is in fact our own offering, our own solution that should illustrate for you that our connected care solutions are playing a very important role in optimizing the care for patients across their whole care pathway, starting from intensive care, where we have of course, our bedside monitoring, but also contactless wearable sensors. When the patient goes to the ward, these wearable sensors can still be on the patients, with the patient, so that monitoring can continue and is seamlessly connected to the monitoring that that patient had to a higher level or on a higher acuity scale in the intensive care. And we can move with that contactless wearable sensor in the home, in the post-acute phase, but also in the long-term phase, and help the patient as well as his care providers to monitor the disease, to monitor the outcome via patient dashboard, but also via caregiver dashboards in the hospital or in the doctor's office. We can integrate in these measurements or in these monitors all kinds of medical measurement devices, also medical devices that are not Philips proprietary. So third-party wearables can also be integrated into these dashboards. So to summarize and give you the key takeaways of my lecture today, I think it is clear for all of us that COVID-19 has really accelerated the digital innovation. I also hope that I have shown you that we are really embracing the platform approach and the ecosystem approach. Philips is ready to step into ecosystems to grant room for other companies, for other care providers, for other partners in the ecosystem in order to increase the health outcome of patients and to work on our quadruple aim. To work on the quadruple aim is a task, I think, for all of us, not only for Philips, also for you as healthcare providers. And finally, we are increasingly co-creating with our customers the solutions that fit best with their unmet needs. So I would like to close it here, and maybe there is time for some questions. Thank you very much.
Thank you, Jan. Very interesting. Very interesting. I have a question to start, and maybe some other will follow. The concept of health continuum is probably a very interesting concept that was developed by Philips in the last years. Obviously, you have a very important product and service offer related to diagnosis and treatment, but we see huge interest nowadays related to prevention. Do you have any new project in your roadmap related to the part before getting sick, managing health in large point of view?
Yeah, we have, indeed we have. It's a very good question. I think, to be really honest, our biggest success to date going out of the hospital is in the post-hospital care. So in the remote monitoring of chronic ill patients when they have left the hospital. We have pretty strong propositions there, which I showed already in the slide. And we are taking the challenge now also to go in the pre-hospital care, to help patients through our personal health propositions to manage their care better. And a very tangible example is, it's a little bit out of scope of this meeting most probably, but it has a lot to do with healthcare, and that is our dental offerings. If you look at the amount of money that goes into oral health into dental decay, and dental decay also connected to systemic symptoms, to systemic health, we are working in a very strong ecosystem with our dental products, dental cleaning products, and together with companies that deliver dental care and dental professional societies in one big ecosystem that helps patients better take care of their oral health, their dental hygiene, in order to prevent dental problems later on, but also in order to prevent systemic problems later on. That's a very, very nice ecosystem. We do that together with a number of partners all over the world, which is completely in the preventive atmosphere.
Okay, thank you. Just to go a bit deeper on this point, we see that the healthcare system is vertically organized. So it means that these segments are not working together so easily. And we have seen obviously this during the COVID-19 crisis. Do you think that we need to be more creative looking for new stakeholders? Because when you look at the prevention part of the medical problems, no one is investing there because we don't have any stakeholders, not just in the diagnosis or treatment where you have obviously hospitals and healthcare systems. Do you think that we need to be more creative and reach new big companies that are interested to invest, like for instance, insurance companies?
It's a very, very good question, and it's right on the spot. If we look at the spend of healthcare in the countries in the world, we see that I think less than 2 or 3% of the total cost of healthcare go into prevention. And that is including vaccinations, that is including programs to reduce smoking. And that is the easy part. There is no investment, almost nowhere in the healthcare systems all over the world, in more general preventive programs. And still, I think we have to go there. We are all deeply convinced that we have to do more on prevention in order to reduce the costs of acute care. I don't have a very good answer on who should take the lead there. As a company, you say, okay, we want to bring products and solutions to the market that can help in this prevention, that can reduce obesity, that can help prevent diabetes 2 of happening, that can detect early hypertensive symptoms, for example. It's quite easy to do. The problem is somebody needs to be willing to pay for it. So what we see in a number of countries in the world, that the payment systems are luckily changing. It is not going fast, but at least it is moving. And it goes from a fee-for-service payment system where you are just paid for every exam you do, for every patient you see, towards, and there's a lot of steps in between, towards a sort of capitation payment. So there are a lot of examples in the world, especially in the US, I have to say, where capitation payment is tried out. And capitation payment means that a hospital that is serving a certain population gets a certain amount of dollars per year per patient or per individual in that population. And that hospital has to take care of the whole health continuum, to take care of prevention, to take care of liver transplantation, everything in between. And that would be a wonderful incentive to make prevention more important in the whole spending bucket that a hospital or healthcare system has. And unfortunately, most of the countries, and I think including Belgium, but also the country I'm living in, is still very much siloed. Again, COVID has showed us that this is not a sustainable model for the future. So it has showed us that we have to collaborate, that we have to find another way of reimbursement, that we have to find a way to attack prevention. And I hope and telehealth is a very nice tool in helping us with that. And I hope we will not drop that ball when COVID is away, that we can keep that up and that we can build on what we learned during COVID on telehealth, on remote monitoring, on teaching patients how to behave, on using their surveys, our engagement tools, that we can keep that up also when COVID is not with us anymore to this extent.
Thank you. Last question. We all know Philips as a hardware company producing hardware for forever, should I say. And now, of course, you are a global healthcare actor, for sure. Regarding the prediction part of the health continuum, how do you see in the 5-10 coming years the impact of artificial intelligence, and how do you integrate this within your system for that diagnosis and treatment?
Yeah. First of all, we will in the future be seen less as a hardware company, but more as a partner company with a big chunk of digitalization. If you this week we published our quarterly results of Q3, and there you see that especially the part of Philips that takes care of connected care, where all this healthcare informatics engagement tools for patients is in, has seen the biggest growth over the last year. That's the first part of the question. The second part of the question is on your artificial intelligence. We deeply believe that artificial intelligence will play a role. The quite easy part for us is to integrate it in our whole solutions. For example, in MR magnets, we have artificial intelligence that help doctors position patients well, reduce the time of scanning, reduce the effect of respiration, and help the doctors read the images later on. That is the easy part, but that is full of artificial intelligence. The artificial intelligence that we use in the direct-to-patient market, we do very often by combining what we have already with other partners in the ecosystem. And the two use cases I showed of lindacare and deerhealth are two examples of that. So we are integrating the tools close next to our own artificial intelligence part in, for example, IntelliSpace cardiovascular. We are partnering with lindacare to bring their artificial intelligence tools into our system. So we deeply believe that this is going to be the future.
Thank you. This was the last question. I just would like to thank you for your very interesting speech. And we take a break of 10 minutes before to go to the next speaker, Dominique Pont from France. Merci.
Thank you.